Okay, so according to the CDC, there are an average of 50,000 cases of tick-borne disease in America each year. Of those cases, the majority, about 30,000 cases, are of Lyme disease. I will discuss how to prevent tick bites, what to do if you find a tick on you, and this discussion will focus on specifically Lyme disease. Ticks spread disease, cause severe illness, and there are many steps you can take to protect yourself, your children, and your pets against disease. So what is Lyme disease and how is it transmitted? Lyme disease is caused by a bacteria. It's called Borrelia burgdorferi. It's transmitted by the black-legged deer tick and spread the bacteria in their saliva after they bite you. Most people are infected by the tick in their nymph stage of the life cycle, and that means they're only about 2 millimeters in length. So they're really, really small. They're hard to see, which makes it easy for them to transmit the disease. But it does take about 36 to 48 hours before disease is transmitted, so if you catch it early, the chances of disease is low. So it is a systemic bacterial infection. It causes headache, fatigue, fever, joint pain, and most importantly, it causes a distinctive target-like rash where the tick bites you. So it's like a red center and then like red circles outside of that whenever it bites. If it's left untreated, it can cause damage to joints, to your heart, and to your nervous system. And if it progresses to this point, then the effects are not able to be reversed by treatment. They are found in the eastern United States, mostly from East Texas all the way up to Maine. The most common states for Lyme disease is in the northeastern U.S., so Connecticut, New York, New Jersey, and Massachusetts. According to the Mayo Clinic, treatment for the early stages of disease include oral antibiotic treatment, usually with amoxicillin, and it's a 14 to 21 day cycle. And treatment for the late stages is intravenous antibiotics with penicillins for 14 to 28 days. So prevention is key to preventing the disease. So you should know where the ticks live. They live in tall grasses and bushes and wooded areas. They use a technique called questing to find their next blood meal. Tick bites are more prevalent in the warmer months, so in the spring, summer, and the fall. And before you go outside, you should treat all your camping gear and your camping clothes with a 0.5% permethrin. That is only to treat the clothes and the gear. It's not for your skin. If you use this chemical, you should use it in a well-ventilated area and let the clothes dry completely before you wear them. You should dress your children in long sleeves and light colors, and the long sleeves and long pants should be tucked into your socks, as well as wearing closed-toed boots. You should walk in the center of trails and avoid brushing up to long grasses or bushy areas. If you are going to use an insect repellent on your skin, you should make sure that it contains DEET. That's the only thing that is used to prevent ticks. When you come inside, you should check yourself, your partner, your children, and your pets for ticks. You should check behind your knees, between your fingers and toes, behind your ears, along your hairline, and your scalp, and in your groin. And if you take your clothes off before you shower, you should check like all the places where clothes touch your skin, like around waistbands and socks and everything. And then you should shower after all outdoor activities. So, what do you do if you find a tick on you? So, if you find a tick, you shouldn't like put nail polish or anything like that on there. You should grab tweezers and grab the tick as close to the skin as possible and pull up with even pressure. You don't want to twist or jerk the tick because it leaves their like mouth parts in your skin, and that can still transmit the disease. So once you pull the tick off, you want to clean the area thoroughly with soap and water, and then you also want to dispose of the tick properly. You don't want to like crush it in between your fingers. You put it like in tape or in alcohol, in a bag, something sealed, or you can flush it down the toilet. So if you develop a fever, a rash, or other symptoms of Lyme disease, you should inform your medical provider and seek treatment right away. So, in conclusion, Lyme disease is the most common vector-borne illness in the United States. It's transmitted by ticks, and it's common in the eastern United States. There are many ways to protect yourself from disease, and there are treatments to help you if you are infected. Avoidance of common tick habitats and early detection are best ways to prevent disease. So, one last thing I wanted to talk about was in Martha's Vineyard, where some of the audience members are moving, there are some new experiments being conducted to gene modify the ticks so that they don't transmit Lyme disease. The technology is called CRISPR, and in the handout I've provided for you, there is a website that you can visit that can help teach you about this new initiative. They need approval by government bodies and public support. So if you want the study to be successful, it needs your support. You can use social media, attend public forums, or see your local news for ways to learn and become active in the community to help push this initiative forward. Thank you, and I will take questions now.
So you said early diagnosis is important.
Yes.
And you go to your medical provider or hospital or ER or something. So how do they diagnose if you've got Lyme disease?
It's usually by symptoms. There's no definitive test. That's actually one of the reasons why it's really hard to diagnose, and people don't get treatment right away. They usually think it's something else. But once it's narrowed down, then they start you on the antibiotics to eradicate the bacteria, and you usually get better. So, but one really great way to diagnose is by having that distinctive rash that is seen, that target rash.
Bullseye.
Yeah, it's like a bullseye. Yes, exactly.
Right. And you don't get symptoms for quite a while after you get the rash? Or
yeah, it's usually a few weeks after you're exposed to a tick bite. It's not right away. It usually could be a few weeks after that.
Okay.
Is it possible to be spread from person to person?
No, it's only through vector-borne or tick bites. It's not from person to person, and it's not from your pets can't bite you or something and give it to you either.
Okay. I've never heard of anyone with Lyme disease actually. But is there anyone famous or anyone that we would know of?
It's actually pretty well known in the media. There's a Canadian pop singer named Avril Lavigne, and she was sick for a really long time, and they couldn't figure out why she was sick, and she actually ended up giving up her career because she was so sick for so long, and then they found out it was Lyme disease, and they cured it, and now she's better, and she's back to singing.
Oh, wow.
Yeah.
Right.
I think, any more questions?
No.
Okay, great. Can you turn the camera off? Thank you.